Hi, this is Claude Yancey here at the 2011 American College of Cardiology meeting, and we're discussing the important news items that are emerging, particularly the late-breaking clinical trials. We're delighted to have the PIs available to have these discussions, and I'm especially pleased today to have the PI of the excellent trial, Dr. Gwon. Dr. Gwon is at the Samsung Medical Center in Seoul, South Korea. Now, what he'll be discussing with us is a randomized clinical trial that attempted to understand whether or not 6 months of clopidogrel therapy after the deployment of a drug-eluting stent was as good as 12 months. We all know how important these questions are about the duration of antiplatelet therapy after drug-eluting stents as a way to attenuate the risk of stent rethrombosis, but these issues still remain problematic for us. We have consensus statements. Most people in our country respect the necessity for a year of dual antiplatelet therapy after deployment of the stent, but we understand that we're using observational databases, empiricism, clinical experience to set those thresholds. So first, I'd applaud you and your co-investigators, Dr. Gwon, for taking on this task. And as you and I have talked already, there are some other studies ongoing, but let's talk specifically about the excellent study. So let's start at the beginning. Your hypothesis was what exactly?
Yeah, the hypothesis of our study is the 6-month duration of dual antiplatelet therapy, the clopidogrel in addition to aspirin, is non-inferior to 12 months duration of clopidogrel.
So tell us about the patients you studied.
In terms of target vessel failure at 12 months.
Okay. So tell us about the patients you studied.
The inclusion criteria usual more than 50% diameter stenosis by visual estimation and evidence of myocardial ischemia, and number of stents, so the length of a lesion is the lateral limitation. And we excluded the high-risk patients like the left main stenosis and chronic total occlusion, instant restenosis, and true bifurcation then requires a two-stent technique.
And how many patients?
The 1,443 patients are enrolled.
And so I'm assuming the protocol was patients were randomized as they went to the laboratory for percutaneous coronary intervention.
Right.
And then one group prospectively received only 6 months of prescribed therapy, the other group 12 months, but I'm assuming that both groups got 12 months of some therapy, but it was just placebo. Is that correct?
This is open arm study, not placebo control.
So it was open arm.
Open
okay,
arm,
so
right.
Those that got 6 months knew they were getting 6 months. Those that got 12 months knew they were getting 12 months. So with that in mind, with that study design said, tell us about your results.
Yeah, we found it in terms of the one year target vessel failure rate. This quite comparable and significantly non-inferior in the 6-month group compared to a 12-month group. The 1 year target vessel failure rate was 4.4% in 6-month group versus 4.4% in 12 months versus the 4.7% in 6-month group. Only 0.3% difference of a TVF at 1 year.
Did you have some information about adherence? I'm assuming that both groups took the medicines regularly as prescribed.
Yeah, we prospectively follow the medication information. The median duration of a clopidogrel in 6-month group was 190 days, and 12-month group 375 days. But unfortunately, a considerable proportion of patients did not follow the protocol actually, especially in 6-month group. 25% continued clopidogrel against the protocol because of the various reasons, because of the MACE or target vessel revascularization, or the sign of some chest pain, not necessarily required to MSCCE. So we did a per protocol analysis according to this observation. Found that the difference was somewhat less.
So it's interesting because what you just shared with us is that in the 6-month group, about a fourth of those patients remained on dual antiplatelet therapy beyond 6 months.
Right.
Okay, so that's an important observation that may have contributed to the non-inferiority analysis. What about the risk of bleeding? What did you see?
That there was no difference. The numerically higher bleeding risk bleeding rate in the 12 months group, the not significant difference, especially TIMI major bleeding, was 0.6% in 12 months group and 0.3% in 6 month group. The statistically not significant.
So, what would be your take-home message to our audience?
So in general, we think the 6 month duration of dual antiplatelet therapy is as safe as 12 months. But there is a definitely high risk group, especially diabetics group, or even if there is no statistical significance, but the SES Sirolimus-Eluting Stent is associated with a 2.35-fold increase of hazard ratio. So we can say in low risk patients, especially non-diabetics implanted with the second generation DES, maybe we can safely discontinue clopidogrel at about 6 months, especially the patients at the high risk of bleeding.
Dr. Gwon, I want to thank you for being here.
Thank you.
You know, as we consider this topic area, we are reminded that these areas of concern that we have are important, and that the questions remain somewhat not fully addressed. And so we do have statements, consensus documents, that really inform us on how we should practice now. It is possible that there may be some patients who are sufficiently low risk that drugs like clopidogrel can be discontinued sooner than we thought. But it is also likely that some patients may need to have even greater exposure to dual antiplatelet therapy. So these are works in process, thoughts that we have to continue to entertain. And I think that it's advised that we continue to follow our prevailing statutes, but respect the work that Dr. Gwon and others are doing to try to inform our opinions so that we can provide the best care for our patients who receive drug-eluting stents. This is Claude Yancey at the 2011 ACC meeting doing trials and PIs for the heart.org. Thank you for your attention. I hope this information has been informative.